Hi everyone, I'm Dr. Carla DiGirolamo and I'm a reproductive endocrinologist at Boston IVF. I've been a reproductive endocrinologist for the last coming on 17 years. I started out at Reproductive Science Center and in 2014 we merged and became a bigger, better Boston IVF. So I have continued on in helping people with their fertility journeys now as a Boston IVF doctor. Just a little bit more about me. When I am not being a physician, I am a fitness specialist. I've been in the athletic world as an athlete myself my whole life, and I am also a CrossFit trainer, certified nutrition coach. So when I'm not being a doctor, I am being a fitness professional. So that is my background. So I know a bit about exercise, pregnancy, and also quite a bit about menopause as well. So I just want to take a few minutes to talk about beginning your fertility journey at Boston IVF. We understand how hard it is to make that decision to ask for help. That is not an easy decision to make because this is so private and so emotional and just has a lot of moving parts to it. We do understand how hard it is to even pick up the phone and make that appointment. But don't be afraid. We are here to help, and you're certainly not alone. That is one thing I hear from patients that I see for the first time is how alone that they feel. I can tell you there are some incredible resources out there. Resolve, RESOLVE, is a wonderful organization that allows patients going through family building struggles to really come together, share their experiences, and support each other. So you are not alone in this, and there are resources out there and support groups that can help you. So that's the first step. The first step is actually making that appointment with one of us at Boston IVF. And one of the suggestions I have for people who are just starting their journey is you want to try to acquaint yourself with the lay of the land. I know that first visit can be a little overwhelming with all of the information that we go over. You know, we talk about your entire history, we go through your questionnaires, and then we talk about testing, and there's quite a lot of testing, and sometimes it can be very overwhelming. So it's a good idea to check out our website. We have an awesome website. Lots of credit goes to our marketing team. It's bostonivf.com. And there are some just great resources on that website to start to get you familiar with what happens after you have that first visit. So definitely you want to just kind of acquaint yourself. And then when you come to your visit with your doctor, you will be equipped to have that conversation, and it'll be much less overwhelming if you know what to expect and you have a little background. So, you share your experience. You definitely want to get to know your doctor's nursing team. We have some incredible nurses that work with us at Boston IVF, and they will help you and hold your hand every step of the way. So you'll get to know the nursing team, and they will help you with your testing. And then when your testing is done, typically you circle back with your doctor and they will discuss a plan with you. And again, our nursing team is right there to help you with all the logistics. So that's what the process looks like when you first come to Boston IVF. So with that, I would be happy to take some questions. We're live here for a little bit. I see lots of things coming in on the comments. Bear with me. This is my first Instagram live that I've ever done, so I'm trying to navigate these comments. Says that lots of people have joined. I'm going to press wave here. I'm really not the most savvy, so hopefully I'm doing the right thing. Let's see. So I see that there's lots of people there. I see some hearts coming up. That's really super nice. What are treatment options that we offer? Emily_Red. So we do everything at Boston IVF. We don't just do IVF. Some people come in thinking that all we do is IVF. We don't. We have the whole gamut of fertility treatment. Sometimes people just need some insemination of sperm. Maybe there's a sperm factor. Or sometimes people just need a little bit of medication to boost their ovulation. We have things from being minimally invasive to more state-of-the-art treatment for other things. So there are lots of different treatments we offer. We offer IVF, we offer genetic testing of embryos. We are on the cutting edge of all the latest technology, but at the same time, if you don't need all that technology and just kind of need a little bit of support, we can do that too. Okay. Someone here is saying one thing I would recommend is do not neglect your mental health. You're absolutely right. And we believe strongly in that, which is why we have the Wellness Center at Boston IVF. We know that mental health is a real key player. And it can be stressful. It can be personally stressful. It can be stressful on your relationships. And so we do have the Wellness Center. You can find the link to that on the website, and we have great support there. We have counselors, we have acupuncturists. They really are fantastic in helping people, helping support people through their fertility journey. Oh, I got more waves here. I'm just going to wave to everybody. I'm a Facebook person, so pardon me if I'm not as proficient with this Instagram. Okay, I have someone who is going on May 26th to Boston IVF, 2 years after having her daughter. Congratulations. Tubal reversal, but her tubes are blocked. What could be my next options? So, we would want to check that. We would want to check a lot of things. We would want to do some blood work to see what your egg supply looks like. If we were to do IVF treatment, if your tubes are blocked, then we would want to know how well you would respond. We would then probably want to check your tubes. We have a number of ways to do that. We have a tubal x-ray we can do. We also have some ultrasound-based tubal studies, but you probably would want to confirm whether or not your tubes are blocked. So that would probably be the focus there, is to try to figure out what exactly is the situation. Let's see. Okay, just did a lot of waving. This is all great stuff. Glad you all have taken some time out of your afternoon to chat with me here. Best suggestion for the 2-week wait after an embryo transfer. Yeah, I think if you had your transfer done today, I probably did it for you. That was what I was doing today. I would say try to really, put the mind-body picture together. Things that make you feel good. Okay, that doesn't mean chocolate and Kentucky Fried Chicken. That means like yoga. That means like taking a walk, enjoying nature outside. Be mindful, be in the moment. Don't go thinking about 2 weeks ahead saying, oh no, what if it doesn't work? Because then that's just going to generate negative energy, and that isn't going to help you get through that 2 weeks. My suggestion would be yoga, massage, acupuncture, spending some time with loved ones, getting outside into nature, and just being present in the moment. And then when that 2 weeks, when that pregnancy test comes, you'll deal with it then. But try to minimize stress as much as you can. Stay active. Everybody thinks they have to lie on their back and not move during that 2 weeks. That is not a good thing. Definitely you want to be active within what your usual activity level is. That's how I would suggest managing that 2-week wait. After a failed transfer, can anything be checked as a solution for next time besides ERA? It's really a big picture question, and it depends on your particular situation. Every patient's circumstances are different, and so your doctor who manages your care will know better than anybody what your next best steps are. So there isn't an easy answer to that one. It really depends on your circumstances and what the cycle leading up to that unsuccessful outcome looked like. I'm sorry I'm not hitting the wave for everybody. I'm doing the best I can. What are safe activities during stims and treatment? So really, activity level depends on what your baseline activity level is. So during retrieval, so you're getting injectable medications and your ovaries are enlarging pretty significantly. Pretty much universally, we tell people to take the high impact out of your workouts. I see a lot of athletes because of my background. I see people who run, who do CrossFit, who jump, who are gymnasts. I see all kinds. And so we basically tell people, don't bounce, meaning we don't have people running, don't jump, don't turn upside down. And the reason why you want to avoid those things is because the ovaries are enlarging. They could twist on themselves. And so during the time you're taking injections, and probably for a week or so after retrieval, you want to avoid activities like that. In terms of like when you're on birth control pills or shortly, after that 2-week period has gone by after the retrieval, if you are a marathon runner, then, you can start to ease back into it, do a 5K warm up. If you are sedentary and you've never run before, I don't think you should do a 5K. I think maybe you should go out for a walk. So a lot of activity recommendations really depend on what your baseline level of activity is. But during stim, pretty universally, we don't want people jumping up and down or turning upside down. Advice for someone starting who has PCOS. PCOS, very, very common. I think probably 30% of my personal practice, I deal with PCOS. I think it's a spectrum. There's a wide range of symptoms and signs and severity of PCOS. I think going into it, know that your provider has seen it before. We see it all the time. And rest assured, we will find the best thing for you. PCOS is very easy to fix. If that's the only problem and you are a relatively young person, and that means, probably under 40, it tends to be reasonably easy to fix. So it's not a bad diagnosis to have because we have lots of ways to fix it. What are the risks of taking an immune protocol, prednisone, Lovenox, aspirin after transfer? It really depends. It's a risk-benefit balance. The immune system is very much involved in the implantation process, and a lot of what the immune system does we don't have a real handle on because it's kind of a black box in the science world of IVF. So really, it depends on what your condition is that you're treating, and how to balance that. We like to have the least amount of interference with the immune system as possible, but at the same time, if you are without these medications and that's going to put you at greater risk, obviously you need it. But your doctor who's managing your care should be able to help you with that risk-benefit analysis to make sure that you're doing the right thing after transfer. Supplements do you recommend your patients to take before egg retrieval? So I'm kind of a purist. Like I mentioned, I'm a nutrition coach when I'm not being a doctor. And I truly, strongly believe that the best supplements out there is your produce section at the supermarket. You will get everything you need from the produce section. If you eat whole fruits, vegetables, and lots of them, you're going to do very well by your nutritional support. All of my patients, I do recommend a prenatal vitamin and some DHA, which is omega-3. But my second line from that recommendation is eat lots of fruits and vegetables. That is the single best thing that you can do to promote your health, is sound nutrition. How long will it take for the embryo biopsy results? Usually 2 to 3 weeks from the time the embryos are biopsied, which is usually embryo day 5 or 6 or 7. So 2 to 3 weeks after that, your doctor should have your results. If IVF third best alternative after 10 years tubal ligation, it depends on how old you are. Plain and simple, the chance of successful IVF is directly related to your age at the time that you start. Are there benefits to doing regular fertilization over ICSI? The less we have to manipulate the embryos, the better. If sperm is completely normal, and there is a history of paternity, even if there isn't, if the sperm is normal, there is no need to do ICSI, everything else being equal. But if ICSI is required, then obviously, you want to maximize your chance of fertilization. But, I tend to be a minimalist. I think nature got it right, and if nature is getting it right, we need to let it do its thing whenever we can and just help out where it's needed. So for normal sperm parameters with no male factor, I would not recommend necessarily ICSI unless there is expected poor egg yield. That is an indication for ICSI, just to maximize fertilization. But aside from that, I would say regular insemination, just, it's nature's way of doing it, and nature knows best. Clomid versus Letrozole. It depends. Letrozole is really, really effective in people who are resistant to Clomid. Letrozole is an off-label use of fertility augmentation. It is not FDA approved for that, but there is years and years, maybe decades of good research behind the use of Letrozole. We don't need FDA approval to do something safely. But I do have patients who are resistant to Letrozole and only respond to Clomid. So, it really, really depends on the patients. But I think Letrozole is better for people with PCOS. I think Clomid is better for people with unexplained infertility who have normal ovulation. How long after fibroids removal can you start IVF? That's a great question. It depends on how old you are. One of our colleagues, Dr. Stephanie Morris, who is a minimally invasive GYN surgeon over at Newton Wellesley, Dr. Morris recommends a minimum of a 3-month wait to let the uterus heal before we attempt conception. That makes us take a little bit of pause, but when you're someone who's 40 years old, you don't have much time, the risk-benefit equation favors going a little earlier than not. Generally, I like to go 6 months if it's possible, and let that uterus heal as much as we can. Do you advise someone to have an FET when they have a 5-centimeter cyst for years and have hydrosalpinx with a prior miscarriage? That's a complicated situation. Typically when there is fluid in the fallopian tubes, we like to either ligate off the tube, meaning just like put a clip in it to prevent the fluid in the tube from getting into the uterus. If there's a 5-centimeter cyst there, it sounds like there's a lot going on in that pelvis. You may want to talk to your doctor about a surgical consultation just to see if there would be any benefit to going in and seeing what's going on. But that's a complex situation you want to speak to your doctor about. All right. I hope I got all the questions. Do you perform hysteroscopy on site at Boston IVF? Yes, we do. Some of the doctors have time set aside to do office hysteroscopy, which doesn't require you to go to sleep. We can just, take a look and see, if the cavity is normal. That's the stuff we do in the office. We do operative hysteroscopy where you go to sleep, have a polyp removed, etc. We do that in our surgical center where we do the egg retrievals. We are a little bit limited. We can't take out like big fibroids. We don't have the equipment to do that, but we do some more simpler hysteroscopy that you would go to sleep for, and we also do the diagnostic ones, just looking in the office. Do we see a correlation between AMH levels and IVF success? I think there's more of a correlation between AMH and egg yield. There's a lot of factors beyond, once you have the eggs that determine success. So the data that I'm most familiar with is really AMH's correlation with egg yield. What are the benefits of acupuncture during fertility treatments? I think if you enjoy acupuncture, the stress relieving benefits of it are tremendous. This is a very stressful process, even under the best of circumstances. And so if acupuncture is something you look forward to, if it's something that is relaxing and that you enjoy, by all means do it. If you are needle phobic, I don't recommend acupuncture. That could be a very traumatic thing for you if you are afraid of needles. So I think the greatest benefits of acupuncture during IVF treatment are the relaxation benefits and the stress management of it. Can I do a pap smear test 1 month before starting IVF? Yes, I don't see why not. I think that's the shortest answer I gave you guys today. Let's see. Yeah, okay. I'm not seeing anything else here. We got about 6 minutes before I have to sign off. I'm just going to keep waving to people here. Thank you for the heart. Why do some people say that IVF patients have to be induced? I'm assuming what you mean is induced for labor. I'm not sure. Sometimes with patients with IVF, there are some correlations with some increased complications, minor obstetrical complications that may require induction. I don't know if it's a mix of maybe physicians or obstetricians being a little bit more cautious with IVF patients. There could be a number of reasons why. There's no hard and fast correlation with IVF patients and need for induction. But those are some of the factors that probably factor into that decision about induction. What's the price range for IVF? So half the cost of IVF, if you're paying out of pocket, okay, so this is strictly if you're paying for this out of pocket. In Massachusetts, there is a state mandate to cover some aspect of coverage with fertility. If you have a private insurance or federal insurance, many times they don't cover. But if you were to pay out of pocket with no insurance help, half the cost is going to be medications, which is usually between $5,000 and $7,000. And on top of that, I believe our IVF prices are, oh God, they change all the time, somewhere between $5,000 and $7,000. It's extra if you need ICSI. I think that's like an extra $2,700. Genetic testing of embryos is another $4,000. So there are lots of different things that incur cost when we do IVF. So our financial team is a really good resource for those exact numbers. But if I give people a ballpark, I usually tell them plan on about $15,000 out of pocket for an IVF cycle. Are you able to call in to get your results of progress of day 3 embryos? Typically, we ask patients not to call in to get results of day 3 embryos because the standard protocol is that we don't automatically check them on day 3. Embryos do best when they're left alone. The incubators that we use are low oxygen incubators, and every time we open the door of the incubator, it then equilibrates with room air. So our embryologists, with all of their study and research and just how super smart they are, have said it's more beneficial if we just close that incubator door and leave them alone. So we no longer do that. That was kind of something we did in the remote past where we would give people day 3 updates, but that's not something we do anymore. If you're having genetic testing of embryos, then we do laser the eggshell, the zona pellucida, on day 3. So they are checked if you are doing genetic testing. But as a routine with a standard IVF cycle, we don't usually check them on day 3. What would cause an embryo to split after you graduated from clinic? That's an age-old question. We know that IVF cycles that there is a higher chance of what we call monozygotic twinning. So that is when a single embryo splits into two. It's been an age-old mystery for decades and decades of why IVF cycles are more prone to embryo splitting. We haven't been able to pin down any one reason. Is it ICSI? Is it assisted hatching? Is it, PGT? We don't know. All we know is that it does happen more frequently in IVF cycles, but we've been trying to answer that question for decades. Oh, I'm sorry, there was something about rural Maine, but it kind of flew off the screen here. I can't see the entire question. You're very welcome, Emily. Got about a minute left here. I can take one more question if I can see it come up on the screen. How many egg transfer would be ideal at age 44? Pretty much everything you've got. At 44, odds are tough. But if you got more than 8 or 10 eggs at egg retrieval, that does put you in a different success rate group. But I wouldn't hesitate to put in, a fair number of embryos that you have. Speak to your doctor. Again, there are other factors, medical conditions, risk of twins, how risky would twins or multiples be for you. That factors into that equation. But generally, we're pretty liberal with how many embryos we put into a 44-year-old. If it's her own eggs. If it's donor egg, it's just one. If it's genetically tested embryos, then again, just one. But anyway. All right, my friends, it's 4:00. I have a hard stop here. It was nice chatting with all of you. Thank you for joining, and we'll see you soon. Take care.